And here we have Lucia. She's a 15-month-old, and we've spoken with Mom, and we've gotten Mom's history and baby's history and a history of her birth and how she's doing now. And she's happily nursing, so I'm going to treat her while she nurses. And I'm going to start with her feet and tailbone. So first I was checking her feet and the ankles and how the legs line up. And now I have 2 fingers on her tailbone, which is the bottom end of the central nervous system. And sometimes when I'm treating a child who might be a little nervous, I'll close my eyes, just because sleeping people are less scary than awake people. So the tailbone gets pushed on during birth. The uterus is a very strong muscle, so sometimes that gets compressed during labor and delivery and contractions. And also as children learn to walk, they sit down hard many times. Everything we do is very gentle. This position of treating the tailbone can be done on a table or can also be done on Mom's lap. I work around the child's comfort level. And then I can sneak up here and see how her tummy is doing and her diaphragm.
Okay. She's helping you. Doing so good.
And children quickly learn that this helps them to feel better. And as they get a little older, they'll often ask to be treated if they don't feel good or if they have a fall. Okay, so now I'm going to go around to the other side. So treating the head of infants and babies is very important. The head is made of, it consists of over 30 bones. And at birth, there are no joints in between any of those bones, except for the mandible and and where the head sits on the neck. And so during birth, the baby's head compresses a little bit so the baby can come through safely. And ideally it re-expands with nursing and breathing at birth. And sometimes depending on the length of labor, the compression that went into those forces of delivery, sometimes babies and children need a little bit of help. The skull is the house for the brain, and the brain's growth makes that skull expand. And so we want that area to be healthy and happy and symmetrical for the growing brain. So this is very gentle work. And she still has her anterior fontanelle is still open. So as it should be at this age, allowing for expansion and growth in the head. So this is a gentle balancing.
Gracias. Thank you.
Everything we do with infants and small children is very, very gentle. If they complain, it's usually because they don't want to be in that position at that particular moment in time. But she's enjoying a little milk and playing with Mom. And she's very effective at nursing. She has a good latch.
Doing so good. Thank you. Jump carrot.
Oh, where'd the carrot go? There you go.
She's helping me feel better.
Yeah.
That's right. Say thank you.
You're going to take a nice nap after this.
Yeah. Mommy likes the sound of that. Yeah. You're doing great. Doing so good.
Sometimes when a small child is being treated and when something releases in their body, you'll see a little, they'll just relax a little bit and cease moving for a couple seconds before they resume their constant motion.
That's her. Constant motion. Huh.
Yeah. Let's check your upper back.